Hello everyone, welcome to the channel. In my last video, I talked about pancreas. If you have not seen the video, then click on the button and watch the video now. Today, I'm going to talk about the next part of our endocrine system, which is adrenal glands. These are also known as suprarenal glands, as you can see this photo, right side, left side. Now, as the name signifies that these glands remains at the upper pole of the kidney, okay, behind the peritoneum. So these glands are also retroperitoneal structure, okay. Now as you can see in this photo, both glands are present at our epigastrium level, okay. I mean behind, actually, as I said, these are retroperitoneal structure. Anyway, so suppose this is the 11th rib and this is the 12th rib. In between this space, there is an intercostal space, actually 11th intercostal space. So opposite to this 11th intercostal space, you will find your adrenal gland left side. Also opposite to the tip of the 12th rib. Also in front of crus of the diaphragm, right side, left side. Now each glands are almost 5 cm in length, 3 cm in broadness, and almost 1 cm in thickness. The weight is approximately 7 to 10 gram. Okay, now the right suprarenal gland or adrenal gland has apex, base, anterior surface, posterior surface, and 3 borders, anterior, medial, and lateral. That's it. And the left suprarenal gland or the adrenal gland has upper, narrow end, and the lower rounded end. Okay, along with anterior surface, posterior surface, medial concave border, and the lateral convex border. Okay, now relations. In relations, I'm going to talk about separately right suprarenal gland and left suprarenal gland. First of all, right one, it has, as I said, apex and base. Apex is related to the bare area of the liver. Okay, I will talk about this later. And the base is related with the upper pole of the kidney. The anterior surface is related with the inferior vena cava, also the bare area of the liver. And the posterior surface is related with the right kidney and the right crux of the diaphragm. Okay, lateral border is related with the liver, medial border is related with the celiac ganglion, and the anterior border is related with the, it has no related because there is the hilum. Hilum means the entry point and the exit point of the vessels and nerves for the adrenal gland. Okay, and in the left suprarenal gland, the upper end is related closely to the spleen, and the lower end has hilum, again the entry and exit point of the vessels and the nerve. Okay, the anterior surface is related with the cardiac end of stomach, pancreas, and the splenic artery. Okay, and the posterior surface is related with the left crus of diaphragm and the left kidney, and the medial border is related with the celiac ganglion. Okay, now in blood supply, you are getting arterial supply and venous drainage. So first of all, arterial supply, you are getting superior suprarenal artery. It is a branch of inferior phrenic artery. You are getting middle suprarenal artery, which is a branch of abdominal aorta, and the inferior suprarenal artery, which is a branch of renal artery. Okay, that's it. In venous drainage, both has single suprarenal vein. Now the right-sided suprarenal vein directly drains into inferior vena cava, and the left-sided suprarenal vein directly drains into left renal vein, which again drains into inferior vena cava. Okay, in nerve supply of the suprarenal gland, you are getting only and only preganglionic sympathetic nervous plexus from T5 to T11. Okay, that's it. Now in the micronutomy and the functions together, see, in the micronutomy, what happens? The adrenal gland has basically 2 layers. One is cortex and there is medulla. And this cortex synthesis naturally hormones and steroid for our body purpose. Okay, so naturally synthesized steroid in our body, and it originates from cortex of the adrenal gland. That's why the steroid's name is cortico from cortex. Cortex corticosteroid. Okay, entire cortex is divided into 3 sub layers. Okay, each layers are known as zona. Okay, not zone, it's zona. So the outer one is known as zona glomerulosa. Now this zona glomerulosa has special type of cells secretes or synthesize aldosterone. Now this aldosterone is a mineralocorticoid. Okay, now the second layer is our zona fasciculata. This has also special kind of cells. It synthesize cortisol. Okay. Now this cortisol is a glucocorticoid. Okay, is a special type of steroid. Now the third one is known as zona reticularis. It has also special type of cells which synthesizes dihydroepiandrosterone, also known as in shortcut DHEA. Okay, DHEA. Now, what about medulla? Medulla consists of almost 10% of the entire adrenal gland, and these medulla consist of very, very special type of cells known as chromaffin cells. Okay. Now, this cell under physical state and the mental condition, it creates, it synthesizes two types of hormone. One is adrenaline, another is noradrenaline, depending on the body situation. I will talk about these things details in later, not now. Now, adrenaline is also known as epinephrine, and the noradrenaline is also known as norepinephrine. That's it. Now, what are these things? What are the functions? Blah blah blah. I will talk about later, not now. So this is all about short video of suprarenal gland, or also known as adrenal gland. Okay, so if you understand a little bit, like it, subscribe it, share it. Till then, bye.